It can be very challenging to differentiate between both viruses because the symptoms are very similar, which could include fevers, aches and pains all over, cough, diarrhea can occur with both. So it can be very challenging to tell which disease one has versus the other. The biggest differentiating factors would be the loss of taste and smell, which occurs preferentially with COVID-19 and not influenza. So that would be the most important difference I would look for. It has been seen in a couple of patients early in this epidemic that patients can have both. It would not be out of the realm of possibility because both viruses would be acquired by the same way, which is namely respiratory droplets. So it is very possible that one could have both diseases at the same time. Short answer, yes, because we have a vaccine that is shown to be efficacious as a whole against one of the viruses versus a person getting both viruses at the same time. So I would strongly recommend still getting the flu vaccine. As a side note, we are seeing in the southern hemisphere that the flu season has been much more mild compared to prior seasons, but that should not prevent people from still getting the flu vaccine. We at Overlake are starting in October, and most other hospitals and physicians in infectious disease would recommend the same thing. Reason being is that what we've seen is that the vaccine probably has its peak efficiency around 6 months after injection. So if you get the vaccine now or in August, if you do the math, you're talking about it losing its ability to protect come February. Well, regularly we see our flu season lasting into April. So there is a 2-month period potentially where one is uncovered if they go too early. Now, one could get a second shot, not unlike the coronavirus anticipated vaccine dosing time. One could get a second flu shot in February and then be protected for the rest of the flu season. And that would be reasonable, but they have to go back for that second. The most important ones would be hand washing and the social distancing as we are doing. Wearing a mask is also very important because this helps reduce the spread of either virus from person to person. If one were not wearing a mask, then coughing into the sleeve, washing your hands after coughing or sneezing would be important as well. First and foremost, I would recommend staying home from work. We do see spread of the virus in the working environment, so trying to isolate yourself as much as possible. I would also seek medical attention if your symptoms are pretty significant at the beginning or they are getting worse. Because of the potential life-threatening nature of both viruses potentially, it's important to be assessed for these diseases and treated appropriately if this is in particular influenza. So I would certainly suggest medical attention right away, staying home from work and self-isolation to prevent spread to others. A couple of things. The first and foremost is be reminded that this is a pandemic, and although the messaging seems very confusing from the CDC and places like that, every day we're learning something new about this virus, and we are getting better at treating these patients. So it does seem like there's a lot of confusion in the messaging, but it's because we're getting more information and having better ability to take care of these patients. So to that end, in my answer, we have to exercise patience because it will be an ongoing learning experience from this point and beyond in terms of this viral illness. The second thing I would comment on would be the role of a vaccine if there's one available. The COVID-19 virus, if we develop a vaccine, would be very similar to my comments about influenza. We would recommend patients getting those. Will there be a vaccine by the end of this year? I think it's unlikely that we would have an actual ready-to-go product by the end of the year. We should certainly have data available knowing whether the particular candidate vaccines are effective, and then going from there, ramping up production and the like. So the earliest to me would probably be sometime in 2021 before we would have available vaccine to give to the common public.